Hey guys, welcome back to my channel, The ENT Resident. Today I'll be discussing about the different signs that you see in a case of juvenile nasopharyngeal angiofibroma. And this is very important from the perspective of your Viva questions, even your theory questions, and even in MCQs if you're appearing for any entrance exams. The signs that we'll talk about today are Chopsticks sign, Holman Miller sign, Hondousa sign, and Ramharan sign. We'll talk about what kind of a sign is this. Is it clinical or a radiological sign? Where do we see it and what does it mean? What is the reason behind it? And we'll also talk about why is it called so. You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our first one, which is the chopstick sign. Now, as you can see over here, this is actually a radiological post-operative sign. It's important to remember this. I'll tell you in a bit that we see when we perform a CT scan of the PNS. Now, what is this sign exactly? We see, if you look at the first image here, the appearance of two parallel bony lines on a post-operative CT scan, which has been done after drilling of the pterygoid wedge, and this is typically associated with surgery for juvenile nasopharyngeal angiofibroma or JNA. This presence of this sign indicates that there has been adequate removal or drilling of the pterygoid wedge during the time of tumor clearance. And this is seen in a post-operative case of JNA. Now, let me try to explain to you what is the reason behind this. So, in cases of JNA surgery, the tumor often ends up extending into the pterygopalatine fossa. So, to achieve complete clearance, you have to drill the pterygoid wedge area. So, if you have done that properly, in a case of post-operative CT scan taken in these cases, we will see that the drilled pterygoid wedge will expose the two pterygoid plates very clearly, and they'll appear like these two straight lines. And this, as you can see, resembles how a pair of chopsticks look like. That is why this has been named as the chopstick sign that we see in a post-operative case of JNA. So this is important here is that this is the only sign which is not a pre-operative diagnostic sign, as in that you'll see in all the three other signs. This is rather a post-operative sign that is a good indicator of adequate pterygoid wedge drilling. Next, we move on to discussing a very famous sign that we all know, which is the Holman Miller sign. Now, what is the Holman Miller sign? Starting with, first of all, this is again a radiological sign that we see on the CT scan of the PNS. What do we see here? What is the finding? As you can see in the image over here, we are able to see an anterior bowing of the posterior wall of the maxillary sinus. So this here you can see this is the maxillary sinus, this is the anterior wall, and this is the posterior wall. So if you see in the left, this side on the left over here, you can see that there is the anterior bowing of the posterior wall of the maxillary sinus. Same in this as well. You can see how it has bent forward. There's a bowing happening here. This is known as a Holman Miller sign. And the other name for Holman Miller sign is Antral sign. And this is a typical sign that we see in JNA cases. Now, why does this happen? So in JNA, we know that tumor usually arises from the site of origin. In cases of JNA is the spinopalatine foramen. This is a very important Viva question. Now, from spinopalatine foramen, eventually as the tumor grows larger, it extends into the pterygopalatine fossa and it starts exerting pressure on the adjacent bone. And it ends up putting a lot of pressure on this maxillary sinus, and it leads to the bowing of the posterior wall. It gets pushed forward. The reason why this is known as Holman Miller sign is because this is actually an eponym, meaning it was named after Holman Miller. Holman and Miller, they both described this typical anterior bowing of the posterior maxillary wall in JNA. So that's about the Holman Miller sign. Another important thing that you need to remember is I just mentioned about the site of origin, which is a very important question. Second is, can you tell me what is the most common symptom that the patient comes to you with? The most common symptom is usually recurrent epistaxis. And the typical presentation is in a adolescent male coming to you with recurrent epistaxis. That will indicate you probably towards the diagnosis of JNA. And it's also important to remember here is that you should not perform a biopsy if you are suspecting a case of GNA. Biopsy is actually contraindicated. Why so? Because this is a very vascular tumor. Because in this tumor, if you try to perform biopsy, it can lead to profuse bleeding. That is why you should not perform a biopsy if you are suspecting a case of GNA. And usually, the cases of JNA is treated with a preoperative embolization followed by surgical excision. There's another little MCQ or a Viva question that you need to know here. There's another sign that we have, which is known as the Dodds sign. I'll talk about this in a separate video. Now, Dodds sign is the sign which helps to differentiate if you're having a doubt between a case of anterocoronal polyp and a case of GNA. In Dodds sign, which is also known as the crescent sign, you will see that there is a positive air crescent in anterocoronal polyp. In JNA, you will not see any crescent, and that's what will help you in differentiating between anterocoronal polyp and the JNA. Next, we move on to a third sign, which is the Hondousa sign. Now, Hondousa sign again is a radiological sign that we will see on a CT scan of the PNS. And here, the sign is we will see a widening of the gap between the maxillary body. This is the maxillary body and the ramus of the mandible, which is this. You can see how the gap is wider over here than this normal side. This is the normal side. You can see that the gap is not as much over here. So this widening of the gap between the maxillary body and the ramus of the mandible, which indicates that there is infratemporal fossa involvement happening over here. And this is typically seen in a case of JNA. So as I mentioned, JNA arises from the sphenopalatine foramen, then it spreads laterally via the pterygopalatine fossa, and then from the pterygopalatine fossa, it goes through the pterygomaxillary fissure. And from that fissure, it ends up in the infratemporal fossa. Now, once it is in the infratemporal fossa, the tumor mass, it starts exerting pressure on the mandible and the maxillary masticator space, leading to the widening of this region between them. This is the characteristic appearance that we are seeing over here, and this is a axial section. Why is it called Hondousa sign? Again, this is an eponym named after Hondousa, who described this particular widening due to the lateral tumor spread in GNA. So these are some things that we know about Hondousa sign over here. Last of all, let's move on to the last one, which is the Ramharan sign. Now, Ramharan sign is also a radiological sign that we are seeing in a case of in a scan of the CT scan of the PNS. Here we are seeing a widening. If let's look at the image over here, this arrow marked over here, we can see a widening of the pterygoid wedge, which is the pterygopalatine fossa, seen on CT scan of the PNS. This is again a typical finding in JNA. So as I mentioned, when the tumor spreads into the pterygopalatine fossa, it leads to the expansion of the pterygopalatine fossa, which leads to this particular finding that we are seeing over here. Now this is a sign which was named after Ramharan. Again, this is an eponym. Ramharan was the one who described this characteristic widening of the pterygoid wedge in JNA. And that's how we end up with the Ramharan sign. So let's recap very quickly. We have seen the chopstick sign. So chopstick sign was the only sign that we saw was a post-operative sign that we see in JNA. Other than this, we saw the Holman Miller sign, we saw the Hondousa sign, and we saw the Ramharan sign. These are three preoperative diagnostic signs that we see for JNA. And we should not confuse, it's very similar over here. Let's try to understand this. We should not confuse between the Ramharan and the Hondousa sign. In Ramharan sign, we are seeing that there is a widening of the pterygoid wedge, right? Whereas in Hondousa sign, we are seeing a widening of the gap between the maxilla and the mandibular ramus, which means there is a widening of the infratemporal fossa. This is the pterygopalatine fossa, Ramharan sign, and the Hondousa sign is a widening of the infratemporal fossa. So that's all about the different signs that we see in JNA. I hope you have understood them. And if you have any doubts regarding this, please note them down in the comment section and I'll get back to you. Thank you.